Hello. I wanted to provide some additional information to you about the medication that I just prescribed for you to treat your vaginal yeast infection. The medication called Fluconazole, and it has a brand name of diflucan. After your pelvic exam at the office and receiving a definite diagnosis of candidiasis or yeast infection, I am confident that the medication will stop the infection permanently and relieve all of the symptoms that you are having, including the irritation, redness, itching, burning, and that whitish discharge that you mentioned from your vagina. This medication is going to work by making it more difficult for the fungi or yeast to make a specific type of cholesterol that it needs to stay healthy. Once the medication starts to work in your body, the yeast cells will develop little holes in them and will quickly die off. Fluconazole is really good at doing this, and it has little effect on any of the other cells in your body. You're going to take a one-time dose of 150 milligrams, just one pill by mouth with a full glass of water. It will not start working right away. It takes hours to get broken apart in your stomach and absorbed into your bloodstream through your intestinal tract. Once it gets there, it's going to be sent to every part of your body. You only need one pill because this medication will keep working to kill the yeast cells for several more days. That is why you may not notice any sudden change after taking it. When the fluconazole has finished traveling through your body, whatever is left over of it will leave in your urine. Your kidneys are functioning normally, so I do not foresee any problems with getting the leftover medication out of your body. Your liver function is also normal. Sometimes there can be damage to the liver with fluconazole and similar medications. If after you take the pill, you start to see like really dark urine, really light colored poop, you have new abdominal pain that you just can't attribute any cause, you get fevers, you have nausea, vomiting, or a yellowish tinge to the skin or the eyes, please call our office or go ahead to the nearest emergency department. There are blood tests that can be done to check your liver health. Fluconazole is safe for infants and children, but we don't know if it's safe for newborns. This medication does cross into breast milk, so it's good that you are not currently nursing. The most common side effects of fluconazole are symptoms in your gastrointestinal tract, like maybe some mild nausea, upset stomach, a little, maybe even vomiting. You could have a little bit of diarrhea. If any of these become severe, please let me know. It's also recommended that you abstain from alcohol when you take this medication and for a couple of days after. It could give you a really upset stomach, it could cause vomiting, and it also increases the chance for any kind of liver damage. There are many medications that have interactions with fluconazole, including medicines to prevent seizures, to treat diabetes, and to thin out the blood. I've checked your medication history for potential problems and found none. It's more likely that my elderly patients would be taking medications like these, and I would be cautious about dosing this treatment for them. While fluconazole is working to cure your vaginal yeast infection, I would also suggest the use of cotton crotch underwear. Avoid any scented lotions or soaps in your vaginal area. Use panty liners to wick away moisture. And you can even add an over-the-counter cream like Vagisil or Monistat to use on the outside areas to relieve the burning and itching that you've been experiencing. I hope this helps. Please contact me with any questions or reach out to your pharmacist. They would be glad to help as well.